my name is Brianna Contreras, and I'm Associate Editor of Managed Healthcare Executive.
Hi, my name is Peter Werwine, and I am Senior Editor of Managed Healthcare Executive.
We are very excited to be sharing a video spotlighting individuals selected for Managed Healthcare Executives' annual 10 Emerging Industry Leaders in Healthcare feature. This is our 4th annual feature, which is shared in our October 2020 issue. We ID candidates by nomination and independent research to identify 30 finalists, and then we window that list down to 10.
And the criteria we use for both the finalists and our final 10 is we look for people who have launched some key initiative, who have had an impact on healthcare, who have taken on increased responsibilities both in their current position and maybe in some past positions. In short, we look for leaders. And then to satisfy the emerging part of 10 emerging healthcare industry leaders, we limit our list to people who have worked in the industry, to folks who have been in it for no more than 15 years.
This is one of our favorite features of the year, where we meet great people to speak with and who belong to a range of fields in healthcare. We hope you enjoy the short video.
You know, both of my parents were diagnosed with life-changing illnesses when I was actually in high school. So it left quite an impression on me. I watched very closely as they sat on phone calls talking about insurance coverage, went to the doctor, poured over pages of information about their own diagnoses. And in that process, really saw just how important it is, you know, even for my folks who were employed, who had a support network, who had higher education, how important it was to get insurance and coverage that was personalized, that was affordable, that was simple. And it became really important to me at that time to figure out a way to help and to make the system better. The biggest thing for us is that we've really taken stock of what our priorities are. You know, we've tried to pare things down to what's most important. And we've really tried to understand what that means, not just for the enterprise, but for the individuals that we serve and the individuals that we employ. So we did a lot for our members through innovative benefits. We've liberalized our coverages and tried to support them in that way. We've created virtual tools to keep them safe but connected to what we offer. And we've done a lot of proactive clinical outreach to ensure that we're connecting regularly with those that are high risk. So certainly pivoting a lot of ways in how we operate the day-to-day business. But we've also doubled down on the work-life balance component for our staff, you know, making sure that we're looking at them as whole people, ensuring that their needs are met in this strange time. And we're laser focused both for our employees as well as for our members around mental health, ensuring that those benefits are strong, ensuring that that's the right approach both for our business and for our employees. It's a huge question, and I'd love to say I have all the answers. I think for me, it's very much challenged me to be a better listener. I think the conversation has offered us all an opportunity to take a step back. I'm proud to see that within the healthcare industry, folks are really acknowledging racism and healthcare inequities as the public health crises that they are. And I think healthcare is uniquely poised over the longer term. You know, that's sort of the jumping off point. Long term, I think we have a chance to really unravel how it is that we're all interconnected and how health inequities impact our day-to-day lives, just given the nature of healthcare and what it means to everyone. And I think as an industry, we have an obligation to stay bold in that conversation. And I think probably the biggest part of that over the long term is growing to be better at listening to our members, listening to our employees, and taking a very different approach in that regard. I really think it brings a lot of perspective to the day-to-day. I think the things that I once took for granted, you know, not that long ago, whether it was heading out for coffee, holding hands, you know, with my mom or giving her a hug, you know, coaching my kids' basketball team and having it be sort of a normal year. Those types of things really are put into perspective in a way that I try to find some joy in. You know, I look forward to going back to those things. And, you know, I don't mind that every once in a while there's a, you know, fort that crops up in my living room because my kids are at home all day with us, and life's just a little bit different. So trying to roll with the punches, but most definitely looking forward to enjoying the little things that, you know, maybe we started to all take for granted.